Assalamu alaikum and welcome to Health Talk. This special episode is again dedicated to breast cancer awareness. Do you know, each year more than 90,000 cases of breast cancer are reported in our country. This staggering figure highlights a growing concern that we simply cannot afford to ignore. What is even more distressing is that breast cancer is now emerging as the leading cause of death in Pakistan. So the gravity of these numbers cannot be overstated. While we can only speculate about the exact cause behind this alarming trend, lack of awareness could be one of the contributing factor. So it's a high time to confront this issue head on, and today's episode is one of the significant steps towards that direction. So as we stand on this enlightening discourse, I'm honored to introduce our distinguished guest, Dr. Kinza Sabir, Head of Department Oncology in PESSI, Lahore, designated as a Senior Registrar in University of Lahore. Assalamu alaikum.
Walaikum salam.
Acha ma'am, our first question is, how do genetic factors contribute to the risk of developing breast cancer?
Like other cancers, breast cancer is also associated with genetic predisposition. About 5 to 10% of breast cancer are associated with the genetic risk. Among most commonest genetic mutations are BRCA1 and BRCA2, in which there is about 50 to 70% increased risk of breast cancer in these mutant population. But routine genetic testing is not advisable. We have to recognize the high risk population either based upon the personal history or family history. History of breast cancer in younger ages, less than 50 years of the age, those having triple negative breast cancers and male breast cancers, and those patients with breast cancer having history of breast cancers in first degree relatives, and as well as history of other malignancies like ovarian, pancreatic tumors in first or second degree relatives. So we need to identify this high risk population, and then we undergo genetic testing. Because by identification of genetic mutations, we can offer risk reducing prophylactic mastectomies to this population, and if they are not willing for these mastectomies, we can offer them high risk screening, in which the screening mammography is offered at younger age, relatively 30 years of the age, and we can also complement the screening along with mammography with MRI breast.
Okay. And what are the most effective methods for breast cancer prevention, and how important is early detection in improving the chances of successful treatment?
Preventive factors are always linked with the risk factors. So there are some factors like genetic and familial factors which can't be modified, but there are some hormonal factors like by encouraging the females to have early marriages and early childbirths, as well as to avoid using of hormonal replacement treatment and oral contraceptive pills, and encourage breastfeeding among their children. So these are the factors which can be offered to the females to avoid the risk of breast cancer. But most important for now is the lifestyle advices. The active lifestyle and healthy diets can prevent the risk factor for general population. But these are the preventive measures which can be offered to general public. But there are some other preventive measures like medical and surgical preventive measures which are offered only to the specific population. Like some patients with some atypical benign breast diseases can be offered some oral treatments like tamoxifen or aromatase inhibitors to prevent development of breast cancer. Similarly, those patients having genetic mutations can be offered risk-reducing prophylactic mastectomies or surgeries to prevent the risk of breast cancer. But these are only for the specific populations. And your second component of your question was that how important it is to detect the breast cancer at earliest stage. This is so important that as early as the disease is diagnosed, we can cure it completely. And most important thing is the person after treatment can lead a normal lifespan just as like a normal individual. So they are completely cured, and for successful treatment we have to diagnose it in the earlier stages for complete treatment.
And also please shed light on breast self-examination.
Yes, in our country, like we are resource deprived, and mammography, which is the recommended tool for screening in breast cancer, uh, there are certain areas, and in many rural areas we don't have access to mammography, and even highly developed medical centers we don't have access to mammography. So in that case it is important, as we have already discussed, that early detection is important. So we counsel our patients and even every female to take 5 minutes for self breast examination to find anything abnormal in their breast, which is very easy because that is not any costly procedure. Just you need to take time and to examine yourself to find any abnormality, because this is the first thing which you feel, and then after that you will approach for any other investigation, maybe ultrasound or maybe mammography. So this is so important that you proceed for self breast examination.
Okay. And breast cancer diagnosis and treatment can be emotionally challenging sometimes. What kind of psychological support and resources are available for the patient and their families during this journey?
Absolutely. Breast cancer diagnosis is quite devastating and traumatizing, not only for the patients and for the families. Unfortunately, we have no massive support programs for these patients, but as a healthcare provider, we have a responsibility to counsel the patients as well as the patient's family. There are the scenarios where patient want to conceal the disease from the family because there are myths that it would be transportable and it would go in the family, or it would transfer to their unborn child. And there are also scenarios in which family wants to conceal the disease from the patient as well. But ideally, the healthcare provider should discuss in complete detail with the patient and the family both about the stage of the disease, the treatment they are going to be offered, and the treatment side effects. Uh, and they also should take into consideration their myths that, as I have already discussed, that it is not so, and most of the early breast cancers are completely curable. So the side effects of many treatment like chemotherapy are reversible, and they will, after a specific time span, the treatment side effects would completely gone. So these all things are very important for counseling of the patient as well as the family, apart from familial and social support. But in the recent scenario, it is expected from the government as well as from the private organization to encourage take initiatives to develop support system, which include not only the healthcare cancer survivors as well as those patients who have been on treatment on cancer, so that they share their issues and problems with each other and become support for each other.
Okay. Although rare, but breast cancer can occur in men as well. What are the unique challenges and considerations when diagnosing and treatment of breast cancer in male patients as compared to female?
Ah. Male breast cancer is very rare, about 1% as compared to that in the females. So the first challenge is to enable the males that you can also have cancer. So this is the most important thing. And when we talk about the counseling or health awareness and discussion, we used to tell people that breast cancer can occur in males as well, and we also need to give insight about the risk factors in males, like genetic factors, or maybe some like hormonal disorder like undescended testes, or like genetic disorders like Klinefelter syndrome. And particularly in male, it can also be due to the hormonal imbalance like estrogen testosterone imbalance. So the diseases like obesity and liver cirrhosis can lead to the increased risk of male breast cancer. So the first challenge is that most of the male breast cancers are diagnosed at the later stages because they do not realize that this lump could be malignant as well. That's why the presentation of male breast cancer is at the later stages, and that's why mortality is high. Rest, as far as the diagnostic procedures and treatment are concerned, that are same in both males and females. So the need is of awareness to make people aware that male breast cancer can also occur.
Okay. And my last question is that some patients explore alternative therapies alongside with conventional treatments or other targeted treatments. So, can you tell me about this?
Yes, as per one study, about 40% of Pakistani population are already dealing with some complementary medications, maybe like herbal medications or hajama therapies, or maybe some other Hakim medications sort of things. But as far as data is concerned, we don't have any sufficient evidence or in support of these medications, particularly for the localized or early stage breast cancer, because as I have told that early stage breast cancer are curable by the conventional means of treatment, either surgery, chemotherapy, radiation, or the newer modalities of the treatment. So, as long as we don't know the ingredient or composition of the drugs which they are taking, we are not sure of their side effects and drug interactions which these drugs can have with the conventional treatment. So, for the localized breast cancer, we encourage patient to be strictly compliant with the treatment which is going to be offered in the oncological setup. But somehow, I must say that for terminally ill patient or for stage 4 palliative patients, when the purpose is palliation, not the cure, in that case, if the patients are satisfied by these medications for the relief of their symptom, like some of patients take marijuana or some herbs for their pain relief. So in that particular stage, when cure is not the objective is just the improvement in quality of life and improvement in well-being. In that case, for stage 4 and palliative patients, they can concurrently take this medication for their disease.
Thank you so much, ma'am, for your time and expertise. So for more informative videos, you can visit our website www.himmelpharmaceuticals.pk, or you can visit our different social media platforms. Till then, take care and Allah Hafiz.